Welcome to The Explainer. Today, we're taking a deep dive into one of the most common surgeries out there, a tonsillectomy. But we're not going to focus on the surgeon's scalpel. Nope, we're going to pull back the curtain on the anesthesia, the whole process that keeps you safe and sound asleep. Let's get into it.
So here's our game plan. We're going to follow the entire journey, right from the very beginning, deciding to have the surgery, all the way to waking up in the recovery room. You'll get a full picture of what actually happens, and more importantly, why every single step matters so much.
All right, first things first, why would anyone need to get their tonsils taken out in the first place? Let's quickly look at the medical reasons that kick this whole thing off.
Well, it all starts right here, with the tonsils themselves. You can think of them as these little immune system security guards posted at the back of your throat. But what happens when those guards get sick over and over again? Well, sometimes they become the problem themselves. The decision to do the surgery usually comes down to two big reasons. First up is infection. And we're not talking about just one bad sore throat. We mean getting sick again and again, like 3 or more times a year, or having infections that just refuse to go away. The second big reason is obstruction. This is when the tonsils get so big they actually start blocking your airway. This can cause serious issues like sleep apnea, and that can have a domino effect on your whole body.
Now here's something that's really interesting. The way the tonsils are removed can actually change how you feel afterward. The classic cold steel method, with a scalpel, might lead to a bit more bleeding during the operation. But, and this is a big but, patients often say it hurts less after the surgery. On the flip side, hot techniques use heat to cut and seal blood vessels at the same time. This means less bleeding in the moment, but it can often lead to more pain during recovery. It's a really fascinating trade-off, isn't it?
Okay, on to the prep phase. Let's look at everything your medical team does to get ready and make sure things go off without a hitch. And trust me, this part is absolutely crucial for your safety.
You know how it is. You might feel like you're getting the third degree with all the questions about your health, your family, what medicines you're on, but there's a really good reason for every single one. They're building a safety profile, a complete picture of you, to catch any potential risks long before you even see the inside of an operating room.
This pre-op checklist is where that personalized plan really takes shape. Your team needs to know everything. Any recent fevers, if bleeding problems run in your family, even if you have a loose tooth, which is super important when they're working in your mouth. They'll do a careful check of your airway and maybe run some blood work or an ECG. All of this info helps them build an anesthesia plan that is made just for you.
Okay, let's get to the part everyone is most curious about, or, maybe a little nervous about. The moment you actually go under. It's a process called induction. So there are two main ways to get you to sleep. For most adults, it's through an IV. They give you medications like propofol and fentanyl, and you just drift off really, really quickly. But for kids, who might be pretty scared of needles, they often use a mask. The child just breathes in some anesthetic gas until they fall asleep. It's a gentler way to start, but it can be a little slower, especially if their tonsils are already blocking their airway.
As soon as you're completely asleep, the team's #1 job is to protect your airway. They gently place a breathing tube, called an ETT, into your windpipe. This guarantees you're getting all the oxygen you need. They secure it carefully, and then they pack the back of the throat with gauze. This is a super important step. It creates a barrier to make sure nothing, like blood, can get down into your lungs. So, you're asleep, your airway is safe, and the surgeon has started. You might think the anesthesiologist can relax now, right? Not a chance. Let's look at how they watch over you, second by second. Just look at all these layers of safety. While you're sleeping, a whole bank of monitors is tracking every little thing. That EC2O, for example, that's measuring the carbon dioxide you breathe out. It gives the team a real-time, breath-by-breath report card on how well you're breathing. Every single number on that screen is being watched like a hawk. The anesthesiologist is basically a master of balance. Their job is to keep you deep enough asleep that you are completely unaware of everything. But at the same time, they have to manage the medication so precisely that as soon as the surgery's done, you can start waking up quickly and your natural reflexes come back right on cue. It's a real art.
And another huge part of their job is managing your body's fluids. See, in a tonsillectomy, it's actually pretty hard to tell exactly how much blood has been lost.
So, to make sure your blood pressure stays nice and stable, the team gives you IV fluids the whole time, just to keep everything in perfect balance.
All right, let's head into the final phase. We're going to see how this whole carefully orchestrated process comes to an end. Because waking up from anesthesia is just as planned out and important as going to sleep.
Waking up, or emergence, follows a very strict set of rules. First, that gauze pack is carefully taken out. Then, the area is gently suctioned to make sure it's totally clear. You'll be turned onto your side with your head tilted down a bit. This is called the tonsillar position, and it lets any fluid drain out of your mouth instead of down your throat. And only when you're completely awake, with all your reflexes back online, does the breathing tube come out.
So, what's one of the biggest complaints after waking up? Nausea. And honestly, it makes sense. A huge number of patients, up to 65%, feel sick afterwards, usually from a combination of irritation and swallowing a little bit of blood. This is so common that your anesthesiologist will probably give you anti-nausea medicine before you even open your eyes.
Once you're in the recovery room, the team is focused on 4 main things. Number 1, pain control, usually starting with things other than strong opioids. 2, watching you very closely for any signs of swelling in your airway. 3, treating any nausea that might pop up. And 4, monitoring for bleeding. It's the most common complication, which is exactly why they'll leave your IV in for a little while, just in case.
So in the end, a surgery that so many of us just think of as routine is actually this incredibly complex and precise performance. It's a powerful reminder of all the expertise that's at work just behind the scenes. And it really makes you wonder, doesn't it, what other simple procedures are hiding this same amazing level of complexity?